Meanwhile, a senior administration official is telling NBC News the White House is expected to announce a new advisory, a national advisory, that Americans living in coronavirus hotspots should wear cloth face masks. Officials say the expected move is aimed at reducing the risk that the virus could be spread by people who are infected but do not show any symptoms. Initial CDC guidelines advised Americans against wearing masks unless they were healthcare workers or if they were already infected. During yesterday's White House briefing, President Trump said the advisory would not be mandatory.
I think they're going to be coming out with regulations on that, and if people want to abide by them, frankly, I don't think they'll be mandatory because some people don't want to do that. But if people wanted, as an example on the masks, if people wanted to wear them, they can. If people wanted to use scarves, which they have, many people have them, they can. In many cases, the scarf is better. It's thicker. I mean, you can, depending on the material, it's thicker. But they can do that if they want. Now, a recommendation's coming out. We'll see what that recommendation is. But I will say this, they can pretty much decide for themselves right now.
Is the guidance coming out, and when?
Yes.
And when, sir?
In the days ahead, we're currently working through the task force, taking the consultation advice, CDC, our top health experts, and we'll be bringing forward the guidance from the CDC in the next several days.
Just remember, it's not a substitute for everything that we're asking people to do. The most important thing is the social distancing and washing your hands. And we don't want people to get an artificial sense of protection because they're behind a mask. Because if they're touching things, remember, your eyes are not in the mask. So if you're touching things and then touching your eyes, you're exposing yourself in the same way.
New York City Mayor Bill de Blasio yesterday, by the way, announced that he was recommending, and his government was recommending, that New Yorkers do wear a mask as well, following the lead of Los Angeles, which had made that recommendation a couple days prior. Meanwhile, President Trump announced he is expanding the Defense Production Act to push companies to make protective masks and ventilators needed to fight the coronavirus outbreak. The order authorizes the head of FEMA to acquire as many N95 masks from the company 3M as is deemed necessary. The act is expected also to help 6 manufacturers like GE and Medtronic secure supplies needed to make the life-saving machines. In a White House statement, President Trump says the order, quote, will save lives by removing obstacles in the supply chain that threaten the rapid production of ventilators. Mika.
And there are new questions as to how the White House arrived at its projection this week that up to 240,000 Americans could die from the coronavirus. According to the Washington Post, while leading disease forecasters whose research the administration used to reach its conclusion said they don't challenge the number's validity, White House officials have refused to explain how they generated the figure. And they have not provided the underlying data so others can assess its reliability or provide long-term strategies that lower the death count. 3 White House officials tell the Post that some of President Trump's top advisors have expressed doubts about the estimate. And there have been fierce debates inside the White House about its accuracy. The Post reports that a task force meeting this week, Dr. Anthony Fauci told others that there are too many variables at play in the pandemic to make the models reliable, saying, quote, I've looked at the models. I've spent a lot of time on the models. They don't tell you anything. You can't really rely upon models. The CDC director and the vice president's office have reportedly also voiced doubts about the projection's accuracy. While a Columbia University epidemiologist whose models were cited by the White House tells the Post that his own work on the pandemic doesn't go far enough into the future to make predictions akin to White House fatality forecasts. So, Jeffrey Goldberg, a couple of things. As everybody is looking for answers and we're trying to get numbers on masks and supplies getting to hospitals and hotspots around the country and gauge how many cases, the bottom line here is that the one thing that works is the one thing that's being put upon the American people, and that is this physical distancing, social distancing. It's being proven to have worked in California. The governor of California clearly listened to top scientists. We know for a fact he was on the phone with top health policy experts and decided to shut down the state and certain cities the earliest, and the numbers are bearing that out. We have these hotspots and these horrific situations in places like New York City right now, and the only solution right now, the only solution that we have on the horizon is social distancing. Isn't the issue right now, as the economy crumbles and America is being brought to its knees, what is the timeline for real testing across the board, and what is the timeline for a vaccine? Because those are the two things that could lead us out of this, and we have absolutely no answers so many weeks into this crisis.
Well, it's interesting. Underlying the call for social distancing, underlying the call for hand washing and everything else is a deep desire and need for leadership. Stable leadership. Doesn't have to be genius leadership. It has to be stable leadership. You have to get a sense from the top that they have a plan, that they understand the needs across America, not state by state, but across America, and that they are executing. What we're missing right now, a couple of things. One is a feeling that we're getting it straight from the White House, getting straight information, even if it's bad, unpleasant information, that they're talking straight. The other is a sense of a unified plan. If you just listen to Governor Cuomo at the top of the show and then listen to President Trump, I think you can see, this is a fair conclusion, that they project confidence and leadership and stability in very different ways. And so ultimately, this is, if it is true that this is a war, as Donald Trump argues, and that he's a wartime president, we have to have, nobody's going to be able to predict the end of this, but you have to be able to tell the American people, look, this is what we're doing on ventilators. This is what we're doing on surging material to hospitals. This is what we're doing X, Y, and Z. And we just whipsaw all day long, all week long. We're just whipsawing from different conclusion to different conclusion with strange sort of perorations on whether the president is popular on Facebook or not. It's not an ideal situation. So undergirding everything is this leadership question.
Hey, Jon Meacham, I want to ask you about the state of Tennessee where you live. Governor Lee yesterday finally signed a stay-at-home order for Tennessee, following slowly the states of Florida and Georgia and Mississippi, which came online yesterday with those kind of policies. What is your view and the snapshot of what it looks like in Tennessee right now? These are places I think perhaps over the last couple of months thought that this was maybe a New York story and that it might not visit Nashville and Memphis and East Tennessee. What does it look like right now there?
Yeah, I think it mattered enormously that Dolly Parton got involved, honestly. She gave $1 million to Vanderbilt. And she's the real governor, and that helps. Honestly, it sends a signal that this is serious. And our friend Tim McGraw is doing, daily songs from his living room. People who have cultural influence are taking it seriously. And I think that begins to help a climate of opinion that, to go to Jeffrey's point, we're in the midst. I remember thinking at the beginning of this, I hope I don't have to say this, but in fact I do. We have a partisan pandemic. And it depends on where you live and what channels you watch, whether you trust certain facts and data. And to a large extent, and this sounds overly grand, I know, but I think it has the virtue of being true, as Henry Kissinger used to say. The Enlightenment's on trial here. Facts and data that shape human decisions because they are objectively true is something that is now very much under assault. And I think it absolutely begins at the top. And the other thing I hoped at the beginning of this is that this would not become a perpetual referendum or commentary on this particular president. But see, previous point, it's simply a fact that he is not communicating coherently and universally truthfully about what we face. It's very curious. He's become this anti-federalist figure from the 18th century, right? He suddenly, he's states' rights. He loves, the idea that somehow or another the border between my state and Kentucky and Mississippi and Georgia and Alabama, somehow or another, the virus is going to see a border and say, oh, wait, that's a Republican governor. I'm not going there. It doesn't work that way. And so I think that people are hungry for direction. I think they're hungry for coherent information. You can find it. God bless the First Amendment. The Atlantic has been doing a fantastic job. The institutions that so many of us trust have been doing a great job. But in a crisis like this, you shouldn't have to freelance health information, right? You shouldn't outsource that to the citizens. So my sense is that anything that Dr. Birx or Dr. Fauci or the vice president, anything that anyone can do to give a stream of fact amid the perpetual reminders about what he did about China will, I think, serve the national interest best.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.